My name is Dr. Daniel Lace, and I'm the Chief Medical Officer for Leaders in Medicine. We work on development and implementation of value-based care strategies for payers, providers, health systems, and that includes the whole gamut from high-techy stuff to actually mobile devices and technology that hopefully can increase patient engagement and provide better value for the care, for the dollars that are spent on care. The advent of the mobile phone and the innumerous apps that are available for that is a great tool and a great platform for collecting information and creating a conduit between healthcare providers and for the patient. And they can fall into several different buckets. Some of them are just reminders. You've got your phone and it's buzzing and it's saying take your medication. There are others that can be educational components to kind of enhance the what the patient knows about their care and information about why it's important for them to be doing the things they need to do for their health care. Can help their own self-care. The other use for technology is actually gathering data points. Like how are you feeling? Is there a glucose meter that's giving you some numbers? Should that be put into this? How are you feeling? What did you just have for lunch? What's your blood pressure? These are ways that we can collect information through a mobile device. And through the magic of the internet and the magic of technology, we can get that information to healthcare providers and start to amass that. Just because we have information doesn't mean we know what to do with that information now. So now it's a matter of going through these large buckets of information and data that are coming from the patient and being able to actually use it in a way that helps the patient's care and thus help create increased value for all of those care components that the patient is having. Payment for communications with patients is kind of in flux right now. Telemedicine is gaining a lot of traction in terms of reimbursement and payment, but telemedicine and asynchronous or desynchronous communication with providers and patients is a different type of animal. It's very important that we understand what we're collecting and the value of it. It may not necessarily be reimbursable, okay, whether it's and where would that reimbursement go? To the provider's office? We certainly wouldn't pay the patient for clicking in some numbers unless they were highly valuable numbers, and we couldn't get any other way. But nothing's passed, nothing's outside of that value decision-making process. If it does create value, then we'd probably go there. I think it's in a lot of flux right now just because it's hard to determine the work and what the payment should be, and then how is that service different than something that could be just obtained by other means, the patient just calling the office or the office calling the patient. From a health plan standpoint, you now have, rather than hundreds or maybe thousands of patients in a group practice, you have maybe millions of members that you're trying to track with that disease. So being able to determine the value and how you would pay for that type of information is difficult at best. And right now is in flux. I think it's going to be worked out soon, but I think the fallback may be that as self-care evolves and patients become much more engaged in their health care, why wouldn't you want to provide all this information in real time, and why wouldn't your providers want to analyze it with smarter systems to be able to come up with better care plans for the patient?